Welcome to Module 4.6, where we'll explore case study research and narrative inquiry, two qualitative approaches that offer unique insights into healthcare phenomena. Case studies provide in-depth understanding of specific situations, while narrative approaches examine how people make meaning through stories. In this module, we'll examine the foundational concepts of these approaches and outline how to conduct this research in healthcare contexts. Case study research involves the in-depth examination of bounded cases, specific instances, situations, or entities with clear boundaries. Research may focus on a single case selected for its uniqueness or representativeness, or multiple cases that allow for comparison and pattern identification. This approach aims for a holistic understanding of phenomena within their real-world contexts, recognizing that context shapes experiences and outcomes. Case studies typically incorporate multiple data sources, including interviews, observations, documents, and archival records, providing triangulation that strengthens findings. Researchers distinguish between instrumental cases, selected to understand broader issues, and intrinsic cases studied for their inherent interest. This approach is particularly valuable for understanding complex healthcare situations, programs, or organizations where context significantly influences outcomes. Conducting case study research begins with careful case selection and bounding, clearly defining what constitutes the case and its boundaries in time and space. Researchers employ multiple data collection methods to capture different dimensions of the case, enhancing validity through methodological triangulation. Analysis typically involves pattern matching, comparing observed patterns with predicted ones, and explanation building that develops causal arguments about the case. When multiple cases are included, cross-case analysis identifies similarities and differences that inform broader understanding. The final product provides rich contextual description that situates findings within their specific settings while drawing out transferable insights. This systematic approach makes case studies particularly valuable for evaluating healthcare programs, understanding organizational change, or examining how contextual factors influence implementation of interventions. Narrative inquiry focuses on stories as both the method and phenomenon of study, examining how people make meaning of experiences through narratives. This approach emphasizes chronology and sequence, recognizing that how stories are organized reveals meaning. Narrative research examines both personal meanings, how individuals make sense of their experiences, and social meanings that connect individual stories to broader cultural narratives. Data collection typically involves narrative interviewing that invites participants to tell their stories with minimal interruption. Analysis may take several forms. Structural analysis examines how stories are constructed. Thematic analysis identifies content patterns across narratives. And dialogic analysis considers how stories are co-constructed and performed. This approach is particularly valuable for understanding patient illness experiences, professional identity development, or how healthcare events are interpreted and incorporated into life stories.